Hello, hello. I think we're going to go ahead and get started. So everybody can grab their seats. We'd appreciate it. Good morning. On behalf of Alexion, AstraZeneca Rare Disease, thank you so much for being here. Thank you to the Boston Globe team for hosting this event. It's a truly important day and appreciate everyone taking time out of their busy schedule and coming today. My name is Scott Weintraub. I lead the U.S. business for Alexion, and it's an honor to not only be able to kick off today's event, but also introduce you in just a moment to Pamela Gavin of NORD, who does tremendous work in this space of rare disease. Before I do, I'd like to take a moment to just reflect on how heartening it is to see so much interest in this topic. As much work has to do on behalf of the community, we also have a strong life sciences ecosystem here in Boston, which is deeply committed to advancing solutions for the rare disease community. And that is the rare disease is truly about. It is a call to action to anyone with the skills, technology, policy capacity, and most of all the passion to transform the lives of more than 400 million people worldwide living with rare disease. Through their eyes, we know the heart-wrenching journey of living with a condition that brings an oft-daunting search for a diagnosis and a need for effective treatments. There are more than 10,000 known rare diseases. Less than 10% actually have a treatment available to them. Not only that, it takes about 5 years to get to a diagnosis, visits to several specialists, and countless tests, and at least one misdiagnosis along that journey. So much so, we often hear from the rare disease community that the day in which they got their diagnosis was an important day or a happy day for them based on the journey that they went through. At Alexion, we have 30 plus years on a mission to do better for people living with rare diseases. We are focused on serving the patients and families affected by rare diseases and the devastating conditions through the discovery, development, and delivery of the life-changing treatments. And we are so proud to do this from our headquarters here in Boston, with a footprint in both Seaport and an expanding footprint in Kendall Square, and with a global reach together with AstraZeneca. We understand the importance of partnership in treating the rare disease community, and there's no better place than the Boston community to do so. But we wouldn't be doing our part if we stopped there. Part of our mission is also advocating for policy and regulatory changes that can have a big impact on patients and their families. This is done through earlier diagnosis, developing the life-saving medicines, and ensuring equitable access for those patients and families. We know that through forums like this one, we can shine a spotlight on the need for diagnostic testing to newborns. We can encourage regulations to continue efforts to bring patients into the drug development process, and we can ensure that there is a strong policy environment that encourages research into the rare disease medicines. There is no question that one way we get there is through collective action and collaboration. And then on this very important theme, I want to hand it over to someone who is a true champion for what we can achieve as a community when we act together. Pam Gavin, CEO of the National Organization for Rare Disorders, is a stored and a steadfast partner to people living with rare diseases and their caregivers, which do a tremendous amount of work, with NORD working to ensure they have been seen, heard, and supported, and connected with a broader community of patients going through the same journey. Certainly there's something we need to hear on Rare Disease Day, but also every day for this community. Thank you again to the Globe. I'm now happy to hand it over to Pam and Anna Kuchment, Health and Medical Editor of the Boston Globe, will take you on the rest of the morning. Thank you.
Thanks so much, Scott, and thanks again to everyone for joining us today. And Pam, thanks to you for joining us today. Maybe why don't you start by telling us just a little bit more about NORD and its mission?
Sure. It's great to be with all of you here today. NORD was started over 40 years ago by folks similar to those of you in this room, people living with rare conditions, advocates and parents predominantly, as well as researchers and clinicians who recognized that we needed to do something different in order to get therapies for these small populations affecting small groups of individuals. And without financial incentives, companies wouldn't and researchers wouldn't necessarily study these conditions or invest in therapy development. Some of them were leaving the space because it wasn't economically feasible. So they got together and demanded that Congress do something. And out of that multi-year process, the Orphan Drug Act was passed. And once it was passed, they actually incorporated into a nonprofit to support one another and to shepherd the implementation of the act itself, because it had, tentacles into the FDA, into NIH, and building really a system or ecosystem, multitude of programs to hopefully achieve what the promise was. And so today, NORD stands as a same nonprofit charity, nonpartisan, independent member organization. So we have almost 400 patient advocacy members who we support and collaborate with, and really focusing on the intersection of access to diagnosis and care, the acceleration of research, the building of community, and of course, the development of therapies, the intersection of all of those together for the community at large.
And how did you first get involved in the rare disease field?
It wasn't intentional by any stretch of the imagination. I had been working, I loved healthcare. I've been working as a healthcare professional, working in healthcare systems in Massachusetts and outside of Massachusetts, and really started to get involved in advocacy as I was focusing on where things go wrong when you're delivering healthcare by no fault of any one party. And that was in the field of patient safety. So building a healthcare system that was patient centric. And I dabbled in a little bit of advocacy there, but it was really my love for systems and human intervention that drove me until rare diseases entered my family. Completely shocked, that knew nothing about rare diseases, knew nothing about this community that was in existence. And my nephew was born with metachromatic leukodystrophy and misdiagnosed multiple times, and eventually diagnosed at Boston Children's here. And my family was the genetic counselors, who were just amazing uh, team at Boston Children's, said, you need to get in touch with NORD. And that's how I was first exposed to NORD, then volunteered, and then eventually became an employee. I was just going to volunteer for a few years and move on with the rest of my career. But it's a labor of love, and I've been able to see, up close and personal, the impact that rare diseases has on families, society, at large.
There have been some dramatic breakthroughs recently with gene therapy and other therapies for rare diseases and not so rare neurodegenerative diseases. I was wondering if you could give me kind of a 30,000-foot view of where we are on our journey to find treatments and cures for these 10,000 some rare diseases.
Yeah, we are at an incredible inflection point. When the Orphan Drug Act was passed, there was less than 40 therapies approved. We're knocking on the door of 1,000 therapies to be approved. If you looked at the ratio of orphan therapies approved year over the last 5 years, they either knocked on 50% of the therapies FDA approved, or just over 50%. And when I started at NORD, I was taught that there were 5,800 known rare diseases back then, and now we're at 10,000. So what is, the progress that we've made in the ratio of orphan therapies approved has been phenomenal. And so that's definitely reflective of the incentives that were built into the Orphan Drug Act. But the problem is that the scientific and technological breakthroughs have outpaced and the challenge of developing therapies and getting them approved in our society. But those scientific and medical breakthroughs and the technological advancements that have brought us all together in warp speed and sharing data in warp speed, we are really at the precipice of something pretty amazing with the use of AI in identifying people, in repurposing drugs, cell and gene therapy, All of those provide incredible promise for us right around the corner.
What are the main challenges that NORD is focused on right now as an organization?
Well, there's many, so I'm like want to make sure with my notes that I don't miss any. There's a lot, as many of you will attest to because you live it every day. So, with incredible unmet need, medical need, and limited resources, we, as an organization, are focused on a couple of strategic approaches. And one is, I'm going to use a Boston nautical, being a Bostonian analogy, rising tides elevates all boats. Investing our resources in things that can help many, right? How to, or technology or solutions that can help. Our focus in many ways starts with a diagnostic odyssey, and we're very focused on leveraging the Centers of Excellence network that we've recently established to help um, bridge the glue and create the glue that binds our fragmented ecosystem to help people get diagnosed more quickly. Because the diagnosis is the first step, right? Once you know what you're dealing with, and you can catalyze your actions from that point forward, whether you're a clinical team or patient or family. So that's one big area that we're focused on. But we're also addressing other issues that are a challenge. It's really hard we're struggling with the field of genetics and ensuring that we have not only genetics but other medical specialties who are expert in rare disease. So, for example, our Students for Rare program in our educational department is focusing on working with our Centers of Excellence to educate the next generation of rare disease experts. So some things are, specific to helping patients and families, and others are, looking down the road at how do we ensure we have a fertile environment that is beneficial to helping people live day to day their best life, as well as investing in research and drug development, therapy development.
Thanks. I just wanted to encourage all of our listeners to submit questions, because I want to make our conversation as helpful as possible to anyone listening. And we'll take a couple of questions at the end. I wanted to ask about, what has been the impact of some of the funding freezes and the disruptions at the federal level on the rare disease field?
How much time do we have? No, just kidding. Oh, where do we begin? I think so initially, there's always a transition when you go from one administration to the next, always. So for our community, we're concerned about a few things. Initially, the lack of communication was, surprising to people because it wasn't business as usual. As you all are well read and follow the news, we're focused on the impact of budget cuts on research. Much of what happens in rare disease relies on NIH research, NIH funding. So we are concerned about that and are expressing our voice and encouraging Congress to ensure that these freezes don't take hold, because we can't really afford to halt scientific and medical research. It's critically important, and we share with those lawmakers who may not be familiar with rare disease or recognize that it's a misnomer because it affects more than 30 million people in this country, that we learn also about common diseases by studying rare diseases. And so we're concerned about that, and we are expressing our concerns that these temporary freezes do not take. We're also concerned about Medicaid, and many children with rare diseases, and of course adults, but many children are served through the Medicaid program across this country. And so significant cuts to Medicaid, um, requirements to work requirements. If you were a parent of a child with a rare disease and one parent has to stop work to stay home to take care of that child, applying employment requirements would be a huge struggle and a big impact. So our policy team is working feverishly on what's happening in that space and trying to stay ahead of it and raise our voices collectively. We encourage all of you to join us in doing the same.
I'm wondering what advice would you have for a family whose child was recently diagnosed with a rare disease that has no current uh, treatment? What would be sort of the first and second steps that they should take?
Well, there's a multitude of steps and things that you could take. Some of it depends upon, the current state of affairs. What is this condition, disease? What's happening with the condition? But there's some internal things that people need to do, which is to ground yourself in building out a support system, reaching out to your local community, to disease state patient advocacy organizations that may exist. And if they don't exist, you can reach out to organizations like NORD. We have a database of people who are looking to connect with others, building relationships with your clinical community. Sometimes your closest and strongest medical advocate or physician may not be a rare disease expert, but she or he will serve as your team to help coordinate and connect with other rare disease experts. So finding the right medical team and partnering with them is important. Of course, caring for yourself. My grandfather used to say, if you're not healthy, you can't, used to tell my mother, if you're not healthy, you can't take care of your children or your family. So the same is true when you've got the struggle of caring for somebody with a rare disease. You need to stay healthy. You can consider advocacy work, working, NORD, we have lots of different resources, but through also our centers of excellence, connecting people to these researchers and target resources that may be beneficial to what's going on with that condition, as I was saying earlier. It all depends on what that current state of affairs is, which one of those steps you do, in what order, but they're all important to consider at one point or another in their journey.
Great. I'll take two, might be able to have time for two questions from the audience. Those with multiple rare diseases are still often excluded from clinical trials, research, etc. How can we change the system to include more people with rare diseases in clinical trials?
In some ways, you have to go back to those fragmented spaces, right, and create the glue that binds them together. Understanding, ensuring that people are diagnosed. It's really hard to participate in a clinical trial if you're undiagnosed. Good example of that. Educating clinicians who you may be seeing out in the community, primary care physicians and others in rural settings and so on, that clinical trials are options that exist. So increasing awareness, creating a communication network. With our Centers of Excellence network, we are aggregating all the resources that each of these institutions know and have, and so that they can be at a drop of a hat available to you. So if you were, somebody, parent of a child living in Maine, and you have a rare condition and the expert is in Texas, or the trials that are taking place in Texas, connecting to somebody close to you in Portland or in Boston allows you that availability to make that connection. So it's creating those friction points. More of them, more expeditiously, will help get people connected to those trials. And then looking at a systems perspective at how do we create that glue? Where are those fragments exist, what kinds of solutions can we put in place to create, those bridges that we need to create.
Thank you so much. Just, with 1 minute left, I'm just going to ask one last question. It was my question as well as a question from the audience. What promising advances in research and treatments for rare diseases are you most hopeful for? What's on the horizon that you're especially looking forward to?
Well, from personal experience, I can tell you that cell and gene therapy has amazing progress, a potential in gene editing. My nephew was born with metachromatic leukodystrophy. Last year, a gene therapy was approved for metachromatic leukodystrophy. It's just an amazing thing to see children like Giovanni Price, who are now living and thriving because he had the benefit of participating in that trial and going to Italy, being an American citizen. There are incredible opportunities there. There are other things like using AI for drug repurposing that are also really very valuable. I don't think it's any one thing that we should be focused on. I think we have the resources and capacity to focus on all of them at the same time.
All right, thank you so much. Do you have any closing thoughts? Anything I didn't ask you about that you'd like to highlight?
Can't think of any right now. Just pleasure to be here. Grateful for the Boston Globe to shine a light on rare diseases, and especially this week, February 28th is Rare Disease Day, and we encourage you all to take action, wear your stripes, volunteer, and engage with the community at large. Thank you.
Thank you so much. Thanks, everyone.